So this is a wonderful sequence to work and increase the range of motion that we have in our hips. So essentially we're doing some controlled rotations for the ball and socket joint, but we're starting to break that down into segments and build a little bit of strength and awareness of those segments. So when we put it all together, we have a much smoother range of movement within that ball and socket joint of our hips. So the way I want you to start is on your back. And we'll start by working through the left hip. So the first thing is just drawing that left knee in towards the chest and just giving the hip socket a little massage. So we're just using our hands here to roll the knee up in towards the chest and out towards the sides. You might notice areas of tightness, it might feel a little bit pinchy. So just see if you can loosen it off. Also pay attention to your resting leg, so the right leg here. Try and keep it active, which means pushing it down in towards the ground. Try not to let it come away. We're trying to create some separation between the two thigh bones in the pelvis. And then from here, what I want you to do is start to draw that knee in towards the chest as much as you can without feeling like the lower back is starting to change shape or the pelvis is changing shape. And I just want you to actively push your knee in towards your hands as if you were pushing your knee away. So we'll start by just pushing the knee in towards the hands. 3, 2, 1, push. 1, 2. So a little contraction through the left hip. 3, 4 and 5, and then just release the contraction and just give the knee a little squeeze, just getting a little bit more hip flexion. And then we'll do the opposite. You're going to take one hand and place it on the top of the knee and then push in towards the hand. So 3, 2, 1, you're going to push. 1, 2, 3. Make sure the push is coming from the hip flexor, not the tummy, not anywhere else, and relax again. You might find that the knee will come in towards the chest a little easier. We're going to do that one more time. Bring the knee away. 3, 2, 1, push. 1, 2, 3. Let's go a little harder. 4 and 5. And same thing, just loosening off. And then taking the hand onto the top of the knee, same thing, pushing into the hand. Go. 1, 2, a little firmer. 3, 4 and 5. Good stuff. And again, just loosen off. We're then going to take that left leg all the way back down to the floor. And now using the core to keep the pelvis still, we're going to use our hip flexors to pick up the leg and try and draw it into that active hip flexion that we found before, and then taking it back. So we're not passively pulling the knee in towards the chest, we're actively pulling the knee in towards the chest using the hip flexor muscles. And we'll do that one more time. So everything is kind of a count of 3 here for now. Okay, we'll do the other side. So starting to bring the knee in towards the chest, rolling it around. Finding space, almost feeling the socket as you roll this knee around. And then find a place where you can passively draw it in towards the chest. So you were using the hands here and keeping it nice and firm. And now we're going to be pushing into the hands. So sending the knee away. 3, 2 and 1. Push. 1, 2, 3, 4 and 5. And again, just release. Draw that knee in a little closer if you can, keeping that left leg active, so not letting it rise up. We're going to push into the top of the hand now. So 3, 2, 1, push into the hand. 1, 2, 3, 4 and 5. And again, draw the knee in. And we'll do that one more time, both sides. So clasping the hands onto the knee, driving the knee away, a little firmer this time. Push. 1, 2, 3, 4 and 5. Release. and then pushing up high, getting those hip flexors fired up. 3, 2, 1, push. 1, 2, 3, 4, and 5. And again, just release the knee. Okay, now 3 times we're going to pick up this leg, send it towards the chest, actively using the hip flexor muscles. Keep the pelvic floor zipped up, core zipped up to keep the pelvis stable. So we pick up, actively pull the knee towards the chest using the hip flexor muscles, hold there, and take it away for 1. We're going to go 2 more, drawing in, holding, and release. And last one, hold and release. Awesome stuff. We're going to come onto the side, so I'm going to flip over so it's my right on the bottom and my left leg is going to be doing the work. As you lie on your side here, just be mindful, if you want to place a pillow for your head, you're very welcome to. I'm just going to use the bottom of my arm, but you can place something there if this is more comfortable. What we're going to now work on is opening up the hip to find external rotation in the hip joint, or abduction. So we're taking the leg away from the midline. Now we want to firstly stack the hips so the pelvis is level, and we want to make sure that we're not sticking the bottom out too far behind us, so we don't have a big anterior tilt into the pelvis nor a big posterior tilt. You're more likely to have an anterior tilt, so just check in with that, see if you can find a neutral spine. We're going to cinch in the waist and lift up through the pelvic floor here. And with this top leg, we're going to start to draw it back into hip flexion. So just like what we were doing lying on the back, we're going to find as much hip flexion as we can before we start to feel the lower back or the pelvis changing shape. So for me, that's my range there before I end up scooping underneath to try and get more range. So we're trying to really keep control of our movement here. Now what we're going to start to do is, once we've found as much hip flexion as possible, we're going to keep that hip flexion as we start to open up the knee. So we're starting to find external rotation in this ball and socket joint here. Now what tends to happen is we might roll back. So we want to keep the pelvis very level. And we're just going to hold this position. Now I want you to focus on almost sending the knee back and rolling the sole of the foot forwards. What that will do is open up the thigh bone and find more external rotation. So you should find that kicking into the left hip muscles. Hold this position, 3, 2, 1, and then bring the knee back in front of the chest to find hip flexion again. We'll do that 2 more times. We're going to open up into external rotation, keep the pelvis level, keep the waistline cinched in, pelvic floor engaged. Hold this position. Send the knee back and the sole of the foot forwards a little, rotating this thigh bone outwards. Hold. If it's a bit shaky, it's a good thing. And then bring it back. It means that you're kind of working to a range that we're not quite accustomed to. So this is where we can get changes in the body. And again, 1 more time. Open up. Hold this position. Roll the thigh bone outwards. Kick in those outer left hip muscles. Hold here. 3, 2, 1, and then come back in to hip flexion. Good. So this is now, we're going to call this position A. And position B is where we find internal rotation. So we're now going to be doing the opposite with the thigh bone. We're going to be turning it inwards. So position B looks like this. Obviously, everyone's going to be slightly different in how they look depending on what they've got available to them in their range of motion. But essentially, we've turned the thigh bone inwards without dropping the knee. So we want to keep that tension on the hip capsule and on the hip muscles here. Notice that my foot is flexed. So keep flexing your foot. This just keeps the whole leg activated and awake. So this is position B. So we start in position A. So get yourself into position A. pelvis is stacked, pelvic floor engaged, and then start to roll the sole of the foot backwards without trying to drop the knee or arch the back or change the shape in the pelvis, and get to that end range where you start to almost feel the hip about to cramp up. So it's really awake here. And hold this. And then we're going to find position A again. So we start to open up into position A. And again, we hold fire. So see if we can send the knee back, sole of the foot forwards. Hold. 3, 2, 1. And again, position B. Trying not to drop the knee. Keep that tension on the hip. It should be shaking and quite uncomfortable. And then again, we find position A. Hold. And then one more time, we're going to find position B. Hold, take a breath as you exhale. See if you can just get a little bit more rotation. Just challenge yourself, see what you've got. 3, 2, don't put it down. 1. You're then going to glide the knee backwards. So keep this tension on the hip. Start to glide the knee back. You might want to take your top hand and use it as a kickstand so you don't lose your balance. It's going to really kick in through here and then glide it back to position B. And again, take it back, glide, squeeze into that left hip and then bring it forwards. And then last time, glide it back and then bring it forwards. Beautiful work. And then just take it down and give it a quick rest bite. Well done. We're now going to take this movement of position A, position B, and we're actually going to create some repetitions out of it. So really kind of focus and hone in on that area. So we're going to come back into position A, and then from here we're going to drop, roll the sole of the foot back and open for 1. We're going to go for 10. Back, open for 2, back, open for 3. So I'm thinking of turning my thigh bone in, opening it back up, or rotating the sole of my foot back, opening back up. 4, 3, 2, and last one. Good stuff. Bring it down. Fold both knees in so they're a little higher. And now we've got this sort of 90-degree bend going on through our body. We're going to pick up both feet about a foot away from the floor. Drop the top knee down to the bottom. Level up the pelvis so we're not again rolling through the pelvis. And then with very steady pelvis and lower back, we're going to open up the knee, squeeze and lower. So we're now coming into some clams, again zipping up through, cinching through the waist, but trying to stay so still in the pelvis. You should find that you get the knee open a lot better. We've kind of worked on this external rotation, but you should be feeling this in the top hip quite nicely. When you get to the top, just hold for a split second and then come back down. We've got 4 more to finish. 4, 3, 2, and 1. Excellent work. One more thing to finish before we come on to the other side. So this top leg, you're just going to straighten it up. Make sure it's aligned with the whole midline, so it's directly down. And then just take it forwards about 3 or 4 inches. You're then going to turn the thigh bone inwards. So again, we're finding that slight internal rotation in the hip. And then again, with that level pelvis, we're going to start to send the heel up towards the sky. So the toes are almost facing down. We don't want to be turning out. And then dropping down. We're going to come up and lower for 1, 2, 3, 4, 5. Again, see how much range you can get. 7, 9, and this last one we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Take it down. Do a little shake. Okay, so that's your sequence. You're going to move it on to the other side now. Okay, so again, finding that support. If you want, stacking the hips, cinching in the waist, drawing in the pelvic floor. And then from here, we're just going to start to find our hip flexion. Holding here. And then start to find our external rotation. So you might find one side you're more balanced than the other. Try not to lose or spill out the core, so keep everything zipped in when you open up. And then again, we're working on sending the knee back and the sole of the foot forward. So we're opening up this thigh bone in the hip socket. Hold here. This is our position B. And then from here, find position A, which is coming into that hip flexion. And again, we open up to find position B, external rotation. Hold, squeeze, and start to really think about these outer right hip muscles. And again, hip flexion. And external rotation, hold. And one more here. So notice all of these movements, they're not fast at all. We're really trying to put our minds to what's happening in the body. We're trying to really be aware. Now from this position, we're going to find position B. We're going to come into our internal rotation. So again, we want to check that the pelvis isn't arching or the lower back is starting to arch, and we're rolling the sole of the foot backwards, trying not to drop the knee. If you find you can get the tiniest amount of movement and you're really struggling, then you can drop it a little bit, but essentially you really want to keep the tension on this hip. So again, we hold, and then we come into position A, and then hold here. And then again, we find position B, hold. Then again, we find position A. And then again, we find position B, hold. And then position A. And again. And make this one the last one. So from here, we're going to start to find position B, which is our internal rotation, keeping the tension on the hip, and then start to glide the knee back. So maybe using the top hand as a kickstand as you glide back, and then forwards for 1. Again, back. And forwards, trying not to arch the lower back. Come back. And forwards, well done. From there, take it all the way back down. And we're going to do some repetitions of that sort of internal, external rotation at the top. So when we're ready, we're going to find hip flexion, hip external rotation. This is our start position. And then we come into our internal rotation to finish for 1. For 2. For 3. 4. 5. Find the shake. You're sourcing the shake. 6. 7. And last one, 10. Beautiful. And then bring it down. Okay, well done. We're going to bring those feet up a little, knees up a little, lifting the feet about a foot. And then again, stacking into the pelvis, making sure everything's neutral and aligned. We're going to open up this top knee. Try not to let the top part of the pelvis roll with it. And then bringing it back down. We're going for 10. 1. Cinch in the waist. 2. 3. 4. 5 and hold. So little squeeze and hold at the top. 6. Definitely got the shakes. We're going to go 2 more. And remember, on this last one, we're going to hold it up here for 10. So let's find our hold point. 1, 2, cinch in. 3, 4, 5. See if you can open it up a little more. 7, 8, 9, and 10. Bring it down. Whee, well done. Straighten up the leg. Send it forwards by about 3 inches. Rotate the thigh bone inwards so the heel is going to be leading the movement. Cinch in the waist, lift up through the pelvic floor, and then we're going to pick up that leg for 1. Ooh, hello. 2. 3. 4. 5. 6, 7, 8. Last 2, 9, and we're going to hold this last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, and bring it down and give your hip a little bit of love. Amazing job. That is your sequence that is broken down. We've found lots and lots of different movements in our hip there. Doing this on a regular basis, you're going to start to really feel the difference in your sort of walking patterns, your moving patterns. So, voilà.